All right, so medication for mental illness is a very sensitive topic, and I speak from experience here because I have a diagnosis of schizoaffective disorder, which is a type of schizophrenia, and I've been going through psychiatry the past few years. I've been on tons of medications, and believe it or not, the thing that actually healed me for the first time was using nutrition. I never responded well to the medications. I still had symptoms, and I started taking care of my nutrition, my exercise, my overall quality of life and health. And for the first time, I was able to put myself into remission. So I can say that these things for me worked better than any medication. And I've been on tons of medications. So this really got me thinking, and I'm not here to say that there's no time or place for medication because sometimes when somebody is very unstable, they need that initial medication to just get them to stabilize. But after they stabilize, we have to start asking the important questions. What are you going to do to improve your overall health? What are you going to do to take a holistic view of everything you can improve in your life? And we see this very commonly. Somebody who's struggling with depression or anxiety, they go to the psychiatrist and they're automatically labeled and diagnosed and prescribed medication. And the thing that's concerning about this is that there are many causes for these things. There are many causes for depression and anxiety and all types of mental problems. And sometimes it's not a legitimate brain illness. Sometimes people don't have a real disorder that requires medication. Sometimes they have lifestyle factors and psychological problems that are causing these things. And if they restore those aspects of their lives, there's no need for the medication. So, one of the main problems with medication that I've come to understand, and many people will tell you this, it's not just anecdotal, it's a very common thing that people that are put on antidepressants, antipsychotics, they'll tell you it does help me, it does get rid of the depression or the anxiety or the schizophrenia. It can treat those things, but it comes at a very high cost. They come with very severe side effects. People will tell you when they take these medications, it takes away their personality, it makes them emotionally numb, they have no motivation, they just they sort of lose their will to engage in life. So it's a very delicate thing here, because on the one hand, the medication can reduce or treat a mental illness, but on the other hand, you have to deal with these side effects that can actually make your overall health and quality of life worse. So again, the main point here is that I just want people to start considering the reality of these medications, the reality of what is causing their mental health issues, and trying to control the things that they can, trying to take control of their lives and improve their overall health and well-being before they turn to medication as if it's the first and best option rather than using it as a tool or maybe the final option in some cases if nothing else works.